The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of the 1,000 plus submissions, only a select few have become quarter-finalists.
Hi, my name is Helena, and I'm an enrollment coordinator with Bicycle Health. At Bicycle, we're committed to helping folks beat opioid addiction by providing full-service treatment that's all online and completely confidential. We understand that opioid use disorder is a medical condition and should be treated like one in a protected and judgment-free environment. We meet our patients wherever they are by offering treatment completely remote. You'll be able to see a provider from virtually anywhere through video calls in our app. They can prescribe medication if they decide it's right for you, and will send you everything you need to get treatment in the comfort of your own home. Our treatment costs $199 a month. We're in network with a growing number of insurance providers, and you'll only be charged at the time of your first provider appointment. Don't worry, our enrollment team will help you work through all the details. Bicycle Health Service includes video calls with your provider, online groups, and support from a health coach. Thank you for your interest. We look forward to serving you soon.
I'm Ankit Gupta, the CEO and founder of Bicycle Health. We're the leading telemedicine-based treatment provider for opioid use disorder. I started Bicycle Health because we live in a country where over 100,000 individuals lose their lives to opioid addiction every year, and almost 10 million people misuse opioids as well. Despite such high incidence rates, almost 90% of people don't access treatment, and that's due to many barriers like the stigma of addiction, the availability of qualified providers nearby, insurance coverage, confidentiality, and a lot more. And so at Bicycle Health, we deliver a comprehensive care model through our app, which includes medications for addiction treatment, or MAT, psychotherapy, recovery coaching, case management and care navigation, at-home drug testing, and a lot more to help patients enter recovery, get better and achieve their goals, and achieve long-term recovery as well. Our mission is to increase access to high-quality, convenient, and confidential opioid use disorder treatment for all. Now, the opioid epidemic has been raging for decades and is only anticipated to get worse. We've seen opioid-related overdose deaths increase by as high as 30% since the start of the COVID pandemic, and yet care options still remain dangerously limited, largely in part due to barriers such as geographic access, cost, and stigma. I wanted to create a platform that addresses those barriers and takes the epidemic head on by offering high quality, confidential, and convenient care for everyone with an opioid use disorder. I think our superpower is creating the best-in-class care model for opioid use disorder and the underlying technology needed to deliver a high-quality care model in a scalable way. Our personalized outcomes-based platform and our evidence-based care model was recently validated in a peer-reviewed publication in the BMJ. I think our care model is thoughtfully built, accessible, and most of all, helps patients find a true path to recovery in an ever-worsening crisis.
Imagine a collaborative care network that empowers more than 1 million providers across the nation, one that equips them with the information, actionable insights, and support to improve whole-person care through payer and provider collaboration. That network has arrived. Bamboo Health is revolutionizing healthcare by putting the patient at the center. Built from a powerful suite of solutions, we provide patients, payers, and providers the resources to improve patient outcomes through care collaboration. We bridge the gap between physical and behavioral health, connecting data in an unprecedented way. Whether they're at a hospital, clinic, pharmacy, post-acute center, or behavioral health program, our software notifies providers of real-time patient events and delivers actionable insights to improve patient health at the point of care. Those insights are integrated within the clinical workflow, enabling a patient-centered focus to optimize value-based outcomes and deliver improved patient well-being. With access to near real-time information, providers can quickly address needs, connect patients with resources, and administer support in new and holistic ways.
As we know, Our healthcare system is disjointed and comprises of many manual and inefficient processes. This is abundantly clear when it comes to behavioral health crisis response. The launch of the Behavioral Health Lifeline, akin to 911-988, has shed light on how many states remain unprepared to meet their state's crisis needs. Innovating in this space, we created a crisis management system, which helps coordinate care in behavioral health crisis situations. The solution expedites assessment, tracks a patient's journey from call to treatment, and coordinates all stakeholders within one system. It leverages the OpenBeds platform, which facilitates rapid digital referrals and transfers to behavioral health and substance use treatment. It also fosters collaboration among medical, mental health, and social services providers. Using the crisis management system, call centers can communicate with mobile response teams and treatment providers, see service availability, and dispatch mobile crisis teams when needed. The solution is a closed-loop referral network, meaning all parties can track a patient's journey from start to finish in real time. Further, the system is interoperable with telephony and electronic health record systems for seamless integration. And we've seen states benefit from the use of our solutions. In December 2021, Delaware reached 100,000 referrals for substance use and mental health services on their Delaware Treatment and Referral Network, built on the OpenBeds platform. This means the state had 100,000 opportunities to improve the lives of its citizens. While we're encouraged and excited by the results we've seen at Bamboo Health, we know our work is never done. We continue to innovate and push the boundaries in the behavioral health space. And we look to partners like state governments, providers, payers, and organizations like USCF to help us continue to expand access to behavioral health care.
Imagine a medicine made up of pixels and play. Created with cognitive science and proven in clinical studies. A video game
That's what I'm talking about.
that invites your child to discover new worlds,
You did it! Nice!
build their universe,
That question was tough.
capture mystic creatures, boost past challenges, and unlock new characters,
Oh yeah!
all to create positive change. Introducing Endeavor RX, the first prescription ADHD therapy
Look at us, rocking it again!
delivered through a video game experience. Designed to work alongside your treatment plan
Hey, whoa! You were all round, and I was all woot! Awesome!
and proven to improve attention.
We provide online therapy for people with obsessive compulsive disorder and related conditions, where people can come in, they can do live face-to-face sessions with licensed therapists from our network. Between sessions, they can access always-on support from different peer communities and self-help tools. No matter where people live or how much money they make, they can come into the NoCD platform and they can get treatment. The benefit of OCD treatment is that if you treat it effectively, you can regain your life. My name is Stephen Smith, and I'm the co-founder and CEO of NoCD. We provide online therapy for people with obsessive compulsive disorder and related conditions. We really help people regain their life through our platform, where people can come in, they can do live face-to-face sessions with licensed therapists from our network that specialize in the evidence-based treatment for OCD called exposure and response prevention therapy. And then between sessions, they can access always-on support from different peer communities and self-help tools. It's this hybrid of tech and touch that has shown to be more effective and convenient for members. No matter where people live or how much money they make, they can come into the NoCD platform and they can get treatment. In addition, NoCD offers payers the opportunity to better manage one of their most severe and costly behavioral populations. The benefit of OCD treatment is that if you treat it effectively, you can regain your life. We differentiate ourselves from our competitors based on two different principles. First, our community. We have a community of members that is the largest community in the world, and it helps us easily identify people with OCD. The second is the way in which we manage those people. We manage them using a combination of our therapist network as well as our technology. The technology helps members when their therapist isn't available, and the therapists are all specially trained and supervised by our team, so we can guarantee the quality per therapist. Our company's superpower is our focus. Our team is incredibly passionate, and it allows us to focus deeply on what matters most to the business, our members. And that focus has enabled us to build a model that can be scaled efficiently and effectively for people with serious mental illnesses, starting with OCD. We're one of the fastest growing companies right now in the digital behavioral health space. We've been building a platform that it can ultimately solve some of the biggest issues in behavioral health. And we've proven that through our rapid expansion, both nationally as well as internationally, as well as the outcomes that we've generated for our members most of the time.
This is Jason. He's been struggling for a while. He meets with his synchronous health specialist, Lisa, a behavioral health provider. Lisa tells Carla, the synchronous health bot, how to help Jason in between their sessions. Our drag and drop platform makes it easy for the specialist to guide Carla in supporting Jason. Carla is there to send Jason the support he needs in the exact moment he needs it. He can take the skills he learns in session and use them in life.
I'm Dr. Erin Parks, co-founder of Equip, a virtual eating disorder program that brings evidence-based treatment to patients and families in their home. Equip's superpower is that we differentiate between treatment that feels good and treatment that actually works. We are the only telehealth company that employs a full, complete, multidisciplinary team. We have pediatricians, child and adolescent psychiatrists, therapists, dietitians, peer mentors, and family mentors, who are all salaried employees of Equip that train together, get supervised together, and work in unison, delivering evidence-based care. Equip should win the 2021 UCSF Health Award because eating disorders are the second deadliest mental health illness, and they affect everyone. Over 33 million Americans don't have access to the eating disorder care they need, and Equip is here to make sure that they receive life-saving, evidence-based treatment.
Equip is the first fully virtual eating disorder program, providing evidence-based treatment and a multidisciplinary treatment team to all of our families. When families join Equip, they get a pediatrician, a dietitian, a psychiatrist, a therapist, a peer mentor, and a family mentor to help them bring their loved one to full recovery. Now, before I get too far, I want to make sure you know who we are talking about when we say people with eating disorders. At Equip, we're helping kids as young as 5 years old, and we'll soon be helping people who are in their 80s and 90s. We help boys, lots of boys, because nearly half of all people with eating disorders are male. And lastly, we help patients from all ethnicities, races, and economic backgrounds, as eating disorders do not discriminate and affect nearly 30 million Americans. Now, before co-founding Equip, I was clinical faculty at UC San Diego's Eating Disorder Center. While I was proud that we were offering evidence-based care, I saw firsthand how families came from all over the country because they didn't have effective treatment options in their hometowns. Meanwhile, my co-founder, she was running a nonprofit to help people afford eating disorder treatment. We joined forces in 2019 because we knew that we needed to create effective treatment that was truly accessible, physically and financially. In just a few short years, Equip has developed and published multiple papers on our virtual treatment model, expanded into all 50 states, and partnered with over a dozen insurance providers and a few Medicaid plans so that families can use their in-network benefits to access a full year of care with Equip. We are particularly proud of our peer-reviewed outcome paper that was just published last month, showing that in the first 12 weeks of treatment, 80% of our patients achieved their weight restoration goals. Their eating disorder symptoms were reduced by half, and they had a significant reduction in comorbid depression and anxiety. Eating disorders are the second deadliest mental health illness, and yet so many people go decades without a proper diagnosis. Full recovery is possible when patients are given effective treatment. In order to do this, we need everyone to work on breaking their own biases on who they think gets eating disorders and realize that this severe illness can and does affect everyone.
Take control of IBS with Hana in your hands. FDA cleared, clinically proven to provide lasting relief at a fraction of the cost of in-person cognitive behavioral therapy, and the first session's free. Just 10 minutes a day through a convenient, easy-to-follow digital program. Hana IBS consists of 10 sessions, each containing lessons and tools to help patients develop management skills specific to their IBS symptoms. When patients open Hana IBS, they are taken to their current session's landing page. They see their progress, can access past lessons, and prepare for what's next. Notifications and progress bars keep patients motivated and on track. Celebrations and moments of delight happen when patients complete a lesson or a goal.
Thank you for the opportunity to participate today. I'm Steve Basta, the CEO of Hana Therapeutics. Hana's developed a digital therapeutic for irritable bowel syndrome. The problem that we're trying to solve, IBS is a widespread condition with 30 million patients suffering from IBS symptoms in the US. One of the most effective therapeutic alternatives for IBS is cognitive behavioral therapy, delivered traditionally by a therapist. And there are only a couple hundred therapists that are specifically trained in gut-directed CBT. And so there's a mismatch between the number of available therapists and the 30 million patients that need this therapy. So that's the problem. The solution is really straightforward and simple. We've digitized that cognitive behavioral therapy learning so that a patient can go through our mobile app 10 minutes a day, learn all of the skills that they would otherwise get in the context of 8 weeks of therapy sessions, but they can do it at home conveniently with widespread access. So it's a cost and it's an access solution. We believe we should win the category for 4 reasons. One is we lower the cost of healthcare. Our solution is much lower cost than sending a patient to a traditional therapist. 2, we provide proven effective therapy with widespread access, so we can solve the problem for all 30 million patients. 3, we proved our effectiveness in a 558 patient randomized clinical trial. 63% of the patients showed clinically meaningful improvement. It is FDA approved as a treatment indicated for IBS patients. And 4, IBS is an enormous problem. This is a big unmet need that we can solve with a powerful solution. Our superpower is super simple. We take known, proven CBT therapies, we digitize them, and we make them widely accessible at low cost to solve healthcare needs.
Mental health challenges are very common, even when a global pandemic isn't driving uncertainty. Pre-COVID, 40% of people who consulted with a doctor presented with mental health and well-being challenges. Since the onset of COVID-19, the statistics have only worsened. We are pleased to offer a new self-help app to help you support your employees in managing their mental well-being. COA Foundations. Foundations includes evidence-based, interactive activities to help build resilience and manage stress. It includes a library of science-backed content to help your team deal with topics such as stress, poor sleep, worry and anxious thoughts, low self-esteem, and more.
Here at COA Health, we're on a mission to make mental health accessible to everyone. We combine the latest clinical research with breakthrough technologies to deliver mental health support that's accessible, personalized, and effective across the mental health continuum, adapting to users' unique circumstances and breaking down the barriers that prevent so many from accessing care. There's a rising tide of folks that are struggling with their mental health. Through the pandemic, we saw that number of people showing symptoms of anxiety and depression double and nearly triple in some cases. While some people in that group truly need acute care from trained clinicians and primary care doctors, the largest portion of the population doesn't need or might not want that level of treatment. But they do need science-backed resources and encouragement to learn behaviors and personal tools that support mental good health before they get to a more critical tipping point. This starts with the largest and typically underserved portion of the population, the missing middle. COA Foundations, our flagship mental well-being app, continues to rise to the top of user experience, efficacy, and global scalability. We've been named the #1 mental well-being content provider by One Mind Cyber Guide and have received top accolades from ORCA in our category Stress, Anxiety, and Mental Well-being. Our user-facing content and programs are created by expert psychologists and are based in proven therapy modalities: cognitive behavioral therapy, positive psychology, acceptance and commitment training, mindfulness, meditation, and so much more.
What's more is that our ethical principles are at the core of everything we do. We're the only industry solution provider that has a committed and published ethical framework. We undergo an annual external audit to ensure our programs and services are socially responsible by being free from bias. The results are publicly available on our website for transparency. We've conducted numerous RCTs to test the efficacy of our mental health solutions and have seen promising results. In fact, our RCTs have shown a 21% increase in overall mental well-being for Koa Foundation's users after just 4 weeks of use. Today, we serve more than 3 million members worldwide with users in more than 70 countries. And now we keep working hand in hand with our clients and our partners to grow our reach and achieve our mission.
So this is an FDA-approved device that you can use at home. Explain the vision here.
Yeah, thanks for having me on today, Emily. The way that we think about chronic care is that folks who are chronically ill naturally need more care. And so this can't just be done when they're seeing their doctors or within the four walls of a hospital. This also has to extend to their home. You know, if we're monitoring them from their home and if doctors are able to collect more metrics from their home, we're able to see if their condition is worsening over time. And for those folks who are at risk, we're actually able to prevent their disease from escalating.
Now, when people hear simple blood test, a lot of people think of Theranos. I'm sure you've heard investors say that in the boardroom. How is Athelis different, and how do you battle that kind of skepticism?
Yes, no, I've heard of the company Theranos at this point. I think, you know, we really just focused on the data. Like for us, that was what it was. When we started the company was when all of the talks about Theranos really were beginning. And so we took a really focused approach on just clinical trials. What are the numbers telling us? You know, A/B testing and really getting that FDA clearance. And once we got that clearance, you know, we really felt like a lot of the skepticism was falling away. We're not doing hundreds of tests with a single drop of blood. We are focused on 2 tests and we do them really well.
Need to get something off your chest? Meet Wobot, the friendly little bot who's ready to listen 24/7. Wobot's been trained in cognitive behavior therapy, an approach to mental health that is all about identifying distortions in your thinking. Wobot doesn't do therapy, but he can be your guide to help you figure out things on your own. Oh, and he's effective. Some nice people at Stanford University demonstrated that chatting to Wobot for 2 weeks led to significant improvement in mood. Every day he asks how your day is going, how you're feeling, and what you're up to. He builds an emotional model of you over time and can help you see patterns in your mood. As he learns about you, he'll teach you things, like useful strategies and practical tools that have been shown to work. You're not troubling him at all. Honestly, he has nothing else to do. So let Wobot annoy his way into your heart and start feeling better today.
There's a lot more people who are really struggling with their mental health. You have on the one hand a lot of technology that has connected people, and on the other a population that has never felt so disconnected. Wobot is a personal mental health ally that practices cognitive behavioral therapy really, really well and checks in with you frequently to see how you're doing and actually give you a little second to check in with yourself. It's based on challenging your thoughts in the context in which they arise as you live your life. Bond is part of how Wobot is able to connect with people. It's things like trust, knowing that you're not going to be judged, being able to be yourself, but it's really just part of it, right? It's also Wobot's empathy, feeling heard. People can reach out to Wobot, not in spite of it being an AI, but it's because it is. You want to be able to disclose authentically, and we enable that by actually not being human, by removing all of the additional stuff, the stigma, and even the sociocultural baggage of human relationships. It's this interesting dialectic that Wobot is both very, very human, but also enabled by the fact that it really is just an AI.
We have incredible creative writers, many of whom are clinically trained. We have exceptionally talented clinicians. We have cutting edge engineers who have been involved in mental health in the past and quantifying the field, and natural language processing experts and AI and machine learning experts. And it's really a truly multidisciplinary effort that comes together to build Wobot to create this wonderful experience. Our superpower and differentiator is about being able to show up for people in a moment of need. It's our ability to enable that engagement at those critical moments where people aren't able to reach out to another person and yet they just want to feel better.
Welcome to your personal support space. Congratulations on taking the first step to discovering new ways to help you think and feel better. Programs. We provide a range of programs which have been developed through years of clinical research and are designed to help you work through a specific mental health or well-being issue. They use proven methods to improve how you're feeling and are delivered in an accessible and convenient way. Your program is comprised of modules, which have been tailored to meet your needs. You can complete these modules at your own pace, and you will find that the more time and effort you put in, the more they will benefit you. We suggest you aim to complete one module per week. Throughout the program, you will find videos, relevant information, interactive tools, and stories from other people who have used the content. These will help you to reflect on the information you are working through and to find ways to apply what you are learning to your day-to-day life.
Hello, my name is Ken Cahill. I'm the CEO and co-founder of Silvercloud Health, which is now part of Amwell. The solution I want to introduce you to today brings together the best-in-class of digital cognitive behavioral therapy, namely Silvercloud, with the best-in-class of virtual therapy and psychiatry delivery from Amwell, right across our full 50-state network. The offering, which is called Amwell Comprehensive Behavioral Health, is designed to be just that. It meets the user, member, or employee where they are in their journey, enabling payers and providers to deliver the best in terms of evidence-based digital care at the right dosage or titration level, helping those users to act, think, and feel better. Silvercloud comes from over 18 years of direct research, has over 4,700 citations to date, has been proven through 30-plus peer-reviewed studies, full randomized control trials, as well as real-world data from over 1 million active users, all reflecting our vision and our passion to democratize behavioral health care. The need to deliver impactful mental health care has never been higher, with recent research having found that nearly 50% of US adults are living with a mental illness. Trusted today by over 500 organizations to enable or to deliver care, Silvercloud has enabled 80% of its users to report an improvement in their depression or anxiety symptoms using validated patient-reported outcomes, while achieving a 93% user satisfaction rating. We cannot alleviate the current mental health care crisis unless we leverage proven solutions and technology to meet the user where they are on their journey and also deliver real results at scale. Amwell Comprehensive Behavioral Health is akin to a virtual health system, enabling users to have access to the right digital tools, mental health courses, coaching, therapy, and even psychiatry, enabling dramatic improvements in outcomes, in access, all the while reducing the cost of care.
RIA's comprehensive program is a personalized treatment plan that is really benefiting from the app. It starts with the breathalyzer. People pair the breathalyzer, they're able to track and record their progress as they watch their drinking reduce over time. They could use the app as well to schedule appointments with their providers, to look at group sessions that are happening throughout each day with different topics. And when they're scheduling with their providers, they can find times that are outside of the normal scheduled cadence. They could also invite a family member, a sponsor, a doctor to share in their progress in an area called the inner circle. This is really helpful to get encouragement. They can look at their prescriptions, order new prescriptions or reorder prescriptions, and they have great content for learning about tools and strategies to help them achieve their alcohol-related goals.
Hi, I'm Tom Nixon. I'm the CEO of RIA Health. RIA Health is a technology-enabled telehealth medical practice that treats alcohol use disorder as a center of excellence. Over the past 4 years, we've scaled to be the first national practice delivering evidence-based treatment. We've been fortunate enough to have national partnerships with Anthem, United Health's Optum Group, as well as Magellan, Beacon, and Highmark, and many others. So what sets us apart from our peers? We listen. We did a recent survey that showed 68% of the people that would be looking for care for themselves or a loved one would rather deal with someone that was specifically treating alcohol use disorder as a specialist. We've been approaching treatment with a one-size-fits-all, and it's not listening to the consumer. The other thing that sets us apart from our peers is our objective outcome measures. When you look at the quality measures that people in the addiction space can provide, they're going to be for opioid use disorder, which is a completely different treatment protocol. So our outcomes are very specific to this condition, and they're objective because we're using a Bluetooth breathalyzer that pairs with our app, as well as combining that with patient-reported outcomes for mental well-being, such as GAD-7 and PHQ-9. And working together in collaboration with our partners, we're able to see reductions in emergency department readmissions and reductions in higher levels of care. What's our superpower? When you sit down with our partners, whether they be a health plan, a health system, or an employer, what they'll tell you is it's the data. It's the depth and level of granularity that we have within our data that sets us far apart from our peers, and that gives our partners the confidence that their members are going to get the highest level of care, and they will be able to see that objectively measured in the types of outcomes that we're able to report.
Twill untangles the complexity of a fragmented healthcare system. We weave together the strands of mental and physical health to create digital-first care that is as connected as the body and the mind. After all, if you can't see the whole person, how can you expect to heal them? By combining digital therapeutics, community-based care, and clinically trained AI, Twill intelligently guides each person to the care they need, when they need it, in the way they want it. And because Twill is open by design, it connects seamlessly with third-party services and modern care ecosystems to create a more precise, more personal and engaging, and effective experience at scale that we call precision care. This clinically designed, human-centered approach shortens the gap between need and care, delivering better care at a lower cost for the many, not the few. Twill delivers intelligent healing to patients, providers, payers, employers, and pharma companies, such as Cigna, Anthem, and Biogen, just to name a few. We configure our own products and services and those of our partners into 4 therapeutic sequences. Mental health, MS, psoriasis, and pregnancy. Furthermore, at Twill, we have 3 superpowers. 1. Therapeutic media. We deliver industry-leading levels of engagement with thousands of evidence-based activities and interventions as our method of action. This is to support, manage, and treat symptoms of disease across the FDA regulator spectrum. This ranges from wellness, i.e. our Happify for general well-being, non-prescription digital therapies like BASIS for clinical anxiety and depression, and prescription digital therapies like Ensemble for diagnosed major depressive disorder or generalized anxiety disorder. Our second superpower, therapeutic intelligence. This is our machine learning and artificial intelligence, which enables us to deliver hyper-personalized therapeutic media to improve a patient's care journey and clinical outcomes, both at lower costs. And third, our intelligent healing platform. This provides the integration of all of our features and our sequences on an FDA-regulated platform, including our own therapeutic media and therapeutic intelligence, as well as the technology and services of various customers and partners.
When one worry starts to grow into new worries, and those worries begin to spiral into even bigger fears about the future, you might be experiencing anxiety. Anxiety is just a natural response to everyday situations about money, family, a job, your health, or even things that no one else seems to understand. It's okay to feel a little anxious. That's just self-preservation kicking in to help you react to what's happening. But sometimes your anxiety overreacts and instead traps you in a negative cycle of overwhelming worry, stress, and frustration. This can leave you feeling pretty misunderstood and totally stuck. If this sounds familiar, you're not alone. Years of scientific study have shown us that we can disrupt our cycles of anxiety by breaking down the thoughts and behaviors that cause them. That's why we've created Daylight, an app to help you learn and practice personalized techniques to take control of your anxiety, all while tracking your progress. Start by taking our anxiety type quiz to put a name to what you're feeling. Whether you're an overthinker, self-doubter, or anything in between, it's like an aha moment of personal clarity. Now is the time to take control of your anxiety with the help of Daylight.
We are the leading digital therapeutics company focused on helping millions back to good mental health. Our superpower is reaching those who otherwise would not receive evidence-based mental health care. And so our digital treatments enable people to take control of their mental health through interactive therapy. And so with over 10 million lives covered today, we're already achieving that mission at scale. And with our recent NICE approval, that is going to really accelerate the number of people who can access our therapies. So our major differentiator is our clinical evidence base. It is industry leading in both its quality and its scale. We have over 70 clinical publications now, including 14 randomized control trials. A stat that still blows my mind, more participants have taken part in controlled studies of Sleepio than have ever taken part in studies of Ambien. And those data show that our products and our therapeutics deliver over 70% remission rates. So on a par with in-person therapy, but as scalably as medication. First of which is scalability. We have focused on delivering truly equitable access to evidence-based non-drug therapies for mental health at a time of huge global crisis. Secondly, those are proven to work. And finally, the third reason is the innovations that we've been able to pursue around our business model. So collaborating with PBMs like CVS Health, being able to secure national reimbursement through the NHS in Scotland, and really plowing a path, hopefully, for a whole category of evidence-based digital treatments to help bridge the treatment gap and provide equitable care to all of those who need it.
We're Work at Health. I'm Robin McIntosh, and I'm the co-founder and co-CEO.
I'm Lisa McLaughlin, co-founder and co-CEO of Work at Health.
Work at Health is disrupting the way people recover from addiction in America. Our programs bring together the gold standard of care for substance use, mental health, and primary care into the privacy of people's homes, making it more accessible and more affordable.
Well, we saw a huge cultural revolution take place during COVID for telemedicine and addiction care. Basically, in March of 2020, 80% of rehabs shuttered, and we became the frontline workers pushing forward a new digital form of recovery. And that was incredible for a field that's always kind of been the ugly stepchild of brick and mortar care to become the #1 responders. And also challenging because we were still working against a whole host of prejudices about digital care and fears that it had less quality than traditional care patterns. But we've been able to really come to the forefront and outshine outcomes that all of those organizations have been bragging about for decades.
Work at Health has grown from an idea between the two of us, Lisa and I, to a team of hundreds of employees across the United States. Through video visits, our clinicians and counselors are able to connect with people more than ever before and treat people who need help right in their homes. So they're comfortable, it's private, and it's super convenient, which was part of our mission for starting the company. We find there's an intimacy to this type of work that you simply don't receive in a doctor's office. You say hi to people's families sometimes, you see their contextual surroundings, and it really, I think there's a nice feedback loop where it really helps our clinicians understand things like social determinants of health and other factors that influence substance use disorders. Work It has a lot to look forward to. Expansion is the name of the game for us. It's top of mind.
My grandfather was an amazing person. As my grandfather started aging, he started to need help. He didn't need traditional home care, he really needed me, but I wasn't always available. So I thought it would be interesting to pair him with a pal. So Papa is a platform that connects older adults and families to what we call pals. They are providing companionship, assistance, transportation, house help. They'll take you to the doctor, they'll help you around the house, they'll show you to use technology, but most importantly, they're there to be your pal.
I'm Andrew. I founded Papa about 5 years ago. Papa was originally created to help my grandfather. He needed help and assistance and companionship. He really needed me, but I was busy, doing life. And so I thought it'd be interesting to pair him with a fun, energetic, trustworthy, what we now call pals. And so Papa is a platform that connects older people and families to pals for companionship, assistance, and transportation. And then when you think about healthcare, when you're lonely and isolated, it has huge negative effects on your life. In fact, it's equivalent to smoking 15 cigarettes a day, which you can imagine the negative impact that could have on an individual. And 80% of health outcomes are driven by social needs. If you're lonely, isolated, don't have transportation, have housing issues, maybe are food insecure, all of those things affect you negatively. And if we could pair you with a pal, it could really move the needle, and we're happy to do that every day. We see thousands of members on a daily basis. We'll see 1.5 million hours of companionship in 2022 this year, which is 114 years of human connection. And the interactions are pretty powerful and quite nuanced. We've had members go to the beach with pals. We've had members go to weddings. We'd have members that hadn't been to the doctor in years and be able to go and have that in a confident way. But really the goal of what we're doing is trying to reduce loneliness and isolation and other social needs. This really affects people's physical and mental health, and Papa's been able to make a big impact on both physical and mental well-being.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.